welcome back to my channel. I am Michelle Mills. I am a certified health coach and eczema coach. I help you guys heal eczema naturally. And today we are finally talking about Dupixent, aka Dupixent, okay? So we are diving into what it is, what it does, if there are withdrawal problems, what the side effects are, the questions that you guys have about it, and then you guys can have a discussion in the comments down below about your experience with it if you have ever had it. So we need to dive into this because there is a lot to talk about. I do have my computer right here for reference because I want to be as correct as I possibly can to give you guys all of the correct information. And like I said, I am a health coach. I'm not a doctor, not claiming to be a doctor. If you want this information from a doctor, you might want to not watch this video and go actually speak to a doctor. But we're gonna go over like what it does and the science behind it. But I am gonna be speaking from people's personal experience with it. I have not taken Dupixent. I do not have a personal experience with Dupixent. So with all those disclaimers out of the way, let's just start talking about it because we do have a lot to talk about. So basically what Dupixent is, it's an injection that you take. It's for atopic dermatitis, and it is usually for people with severe atopic dermatitis, eczema. It is not an immunosuppressant and it is not a steroid. So a steroid can be taken orally or topically, but this is completely different. There were also other medications out there that are immunosuppressants. So basically when you have eczema, your immune system is usually overactive and that your immune system is attacking your skin. So immunosuppressants suppress the entire immune system. Dupixent is a little bit different, so it specifically targets IL-4 and IL-13 signaling. And IL stands for interleukin. This is referring to things that occur in our immune system. And so it's saying that you take a dose every 2 to 4 weeks based on age and weight after initial dosing. One last disclaimer, which is my whole channel here and my whole thing is based on healing eczema naturally. This video is kind of in the middle. It's not really telling you to take it or not to take it. I just want you guys to have all the information and know what people experience so that you can make the decision for yourself. I have met people who have had to get on Dupixent because there was no other choice. So the masses being able to share their experience and us being able to see patterns and understand all the different sides to it, like that's my goal. That's why I have this community of people that have eczema, is so that we can share our experiences and learn from one another and figure out whether Dupixent is something that you want to get on. So it is saying it's for moderate to severe atopic dermatitis, ages 6+. In the past, I have been totally against Dupixent. In fact, I was quite angry that it even existed. You have to do something called step therapy before you can even get on Dupixent, which basically means you have to get on steroids before you can get on Dupixent. From there, you have to try light therapy. I mean, I don't know the exact step therapy. I think the thing that frustrates me the most about steroids is when people go through topical steroid withdrawal, which if you have used topical steroids or oral steroids for usually a consistent amount of time, you can go through withdrawal, which basically turns your whole body into like full body eczema, but it's actually TSW, so it usually shows up on the face, the neck, the chest. This is like a little bit of a conspiracy theory. The whole video is not gonna be like this, but I feel as though they made Dupixent for people going through topical steroid withdrawal. Because usually the people that have to get on Dupixent because they have no other choice are people going through topical steroid withdrawal. I coach people through healing eczema naturally, and unfortunately, some of my clients have had to get on Dupixent because the TSW, topical steroid withdrawal, was so severe that they would be hospitalized if they didn't go on Dupixent. There is use for Dupixent. There is reason why people should get on Dupixent. I mean, I would rather somebody like get on it than horrible things happen. So I'm on medlineplus.gov and we are looking at drug information, and we're specifically gonna dive into what this is saying about the Dupixent injection. It is used to treat the symptoms of eczema, atopic dermatitis. This is basically saying that it does also help people with asthma. So there's a couple of different use cases for people to be using Dupixent. The injection may cause redness and pain at the injection site, throat pain, mouth or lip sores. What's interesting is it's not actually noting some of the side effects that I have heard. So maybe I don't love this website so much. Let's actually find another one to get a deeper dive into all of this. The main side effects for Dupixent are reactions that deal with your eyes. And that's what we're gonna read people's personal experiences. Like a lot of them have to do with eye issues. So tell your healthcare provider if you have any new or worsening eye problems, including eye pain, changes in vision. It's also saying inflammation of your blood vessels, which I actually find to be kind of disturbing because people with topical steroid withdrawal often have dilated blood vessels already. And so it's interesting to me that Dupixent is able to help people with TSW, but I guess this isn't in all cases. It's saying to look out for rash, chest pain, a feeling of pins and needles, numbness in your arms and legs, persistent fever. The most common side effects are injection site reactions, eye and eyelid inflammation, pain in the throat, cold sores in your mouth, high count of certain white blood cells, trouble sleeping, toothache, gastritis, joint pain, parasitic infections. I read a lot of stuff, I don't usually hear it, so a lot of times in my videos I might pronounce something wrong, just bear with me. But basically there's a name for like itch that's a more scientific name that doctors and stuff would actually use for the word itch, and it's pruritus. It says that 41% of adults treated with Dupixent have a point reduction in peak pruritus. One thing I just found really interesting on the website, it says that 77% of adult patients treated with Dupixent remained on therapy at 1 year. Of the patients who discontinued therapy, 8 out of the 10 patients returned to Dupixent treatment within 4 months. It's a little bit concerning to me and kind of tells me, like, of the 8 out of 10, why would they return to treatment? Well, probably because, like this is saying, it treats the symptoms, not the root cause. I help people change their lifestyles so that the root causes are actually addressed. So there's a couple different root causes of eczema. This, I think, because it's not getting at the root cause, it's just another band-aid solution like steroids. But I do want to read people who have a long-term relationship with Dupixent and what that was like. I did find a Reddit thread of actual people who were on it. This one person says, I've been on Dupixent for 2.5 years and I've never had any side effects. It completely cleared up my eczema. 2 years ago, this person wrote, same for me, miracle drug changed my life. I've been on it since it was in study. So like 7 years. The only problem is to get FDA approval of the half dose. I used to inject it once a week, now it's every other week. It doesn't work as well. Originally, somebody was voicing their concern, so I'm at about 18 months now, and it's finally reached the point where I feel consistently great. It was a long, slow scope of eczema getting better and weird things around my eyes, peeling skin, redness, watering, fading away, but now my skin's entirely clear and not even itchy. Initially, my skin improved from desperately painful and cracked all over to just a bit patchy and itchy. This happened pretty quickly and felt like revelation. Then over time, I've been able to identify actual allergens and triggers since my baseline isn't so high anymore. So now outbursts are actually noticeably quickly. You know, this is Reddit, so not all of this language is gonna be like perfectly spot on. For the first year or so, I started feeling itchy again around day 10, but in the past few months, I've been able to stretch it further and have accidentally missed day 14 a few times because I don't feel like I need it yet. I've stretched it to every 18 days. I also hear a lot of times that this doesn't necessarily work for all people. Like I've spoke to people who have been on it and it hadn't helped at all. This person says, I've been on it for almost 2 years, completely covered head to toe with eczema when I started. So far, I have just a couple of stubborn places on my calves, my eyes get irritated every now and then, and I still have some flares around my neck, usually induced by my beard. I didn't notice any significant side effects except for the one where I would drink alcohol and turn into a tomato. This whole Reddit feed, which I have linked in the description down below, a lot of them have been talking about every time they drink alcohol, they get flushed. So that's an interesting and weird side effect. I have also pulled up nationaleczema.org, and they have this whole list of people who have been on Dupixent and their reactions, but I will say take what I'm about to say with a grain of salt, because I do know the National Eczema Association has been funded by the company who has created Dupixent and Dupilumab, so it is in their favor to be on the side of positive experiences with Dupixent. So let's just keep that in mind as we read these. This one says that I've been on Dupixent for 2.5 years and it's the most effective treatment I've ever had. I have severe asthma and allergies to everything on the planet. At a certain point, I couldn't even touch water. And as for my skin, I looked like a burn victim, as if my whole body was leaking fluids. Every pore was like an open wound, which sounds like topical steroid withdrawal to me. He said that Dupixent has improved his AD and asthma significantly. I still have allergies, but Dupixent reduced 2 out of my 3 major health problems, which is amazing. This other one says that Dupixent is still a work in progress. And I read this earlier. As time passes, researchers are learning more about Dupixent's effectiveness as well as its limitations. Some patients turn out to be partial respondents to the drug, meaning it improves their condition, but not as much as expected after 16 weeks of treatment. Another small group called non-durable responders do well on Dupixent at first, but the drug's benefits gradually wear off. Basically, eczema is inflammation, and that makes me feel as though that the people who are non-durable responders have such intense inflammation that even Dupixent isn't keeping the inflammation at bay, which concerns me because inflammation is so horrible for the body, not just the symptoms of eczema, but there's a lot that happens in your body. Your organs are all interconnected and a lot of stuff is going on. So I guess from what I'm hearing, yes, Dupixent can be helpful for some people. We will go over the withdrawal symptoms in a few minutes. I think that if you're going to try to get on it, you also need to be thinking about how to heal your body naturally and how to reduce inflammation naturally at the same time. Because we're not just trying to get rid of our eczema, it's a whole body situation where you may be developing high blood pressure or heart disease or so many other issues that your inflammation could be causing. So it's not just about the eczema. My program that I run for people is called Empowered Eczema. It's a 3-month-long program. And the reason why it's called Empowered Eczema is because people can become empowered by their eczema by realizing that our bodies are very sensitive and shows us inflammation so easily, whereas other people don't even know that they have heart disease until they have an event as a heart attack, basically. So I think that eczema is cool in a way. Yes, it causes a lot of people to suffer, but it is nice that our bodies are able to show us these signs of inflammation. So I just wanted to throw that in there. My channel is about natural healing, so I would be doing you a disservice if I didn't mention that in this video. Okay, so before we dive into the withdrawal symptoms and all of that, I am on WebMD.com and I have user reviews for Dupixent. It has an overall rating of 3.7 stars out of 5. So the most positive review says, I've used Dupixent for about a year. Took it every other week for a while now, once a week. Clearing up, nice. My breakouts were so bad, my doctor said I was her worst patient, and that's at a big university hospital. So glad they found something that helped me. The most negative review says, by their own statistics, Dupixent works only 40% of the time. So no surprise that it wasn't effective for me. But what makes it worse is the fact that their co-payment reimbursement program is a sham. First, they said they lost my first 3 claims and suggested I resubmit them. Then they denied them because they were too late, even though the original submissions have been on time. Nothing but excuses and non-professionalism. Do not trust their co-payment reimbursement program. That is another aspect to Dupixent, which is how much it costs, what the co-payment is like, and everything of that sort. So maybe I can look into that really quickly for you guys. So on Dupixent.com, it says the amount you pay for Dupixent will largely depend on a number of factors. Whether you have a prescription drug insurance, the type of insurance you have, whether your insurance provider considers the medication to be preferred or not preferred, whether you've met your deductible. Let's do somebody who doesn't have insurance. I don't have insurance. What do most people who are uninsured pay? All prescription medications have a list price. Very few patients pay the list price, which is the price set by the manufacturer. The list price of Dupixent is $3,331.53 per carton, but most people will not pay the list price. So Dupixent is available in cartons containing 2 pre-filled pens. So according to this, the list price from the manufacturer is about $3,000 for 2 injections. Okay, so that was somebody who is uninsured. Let's see somebody on a commercial or employer-provided insurance. 68% of insured patients pay between $0 to $100 per month for Dupixent. That's just like an estimate here. Somebody who's on Medicaid, it says the range is $4 to $9 per month. Somebody on Medicare would expect to pay $0 to $100 per month. At least we know that. Okay, we're gonna go back to those reviews really fast on WebMD. Somebody who was on the medication for 1 to 6 months said, "Worst drug ever. I ended up with extremely itchy eyelids, a severe red patchy facial rash with white heads, and significant hair loss in 2 places in the back of my head." The next one is a female, 35 to 44 years old, says that she's been on the medication for less than 1 month. "I've been suffering with eczema for about 5 years now. You name it, I tried it, nothing works. Many nights I put myself to sleep crying from pain and burning sensation. I was at a point where I was not able to use my hands, which is very depressing. Imagine you can't even open a bottle of water. My doctor recommended Dupixent, and after my first dose 2 weeks ago, OMG, why did I suffer for 5 years? This drug's a lifesaver. I wish I could post a before and after photo so you can see the difference." This is an interesting review. "The needles are very fragile and dull. I have bent the needle trying to pierce my skin on more than 1 occasion. Significant sting from the medication. I use an ice pack to numb some before and immediately after injection." I am now incredibly curious. It seems like a lot of the people who have consistently stayed on Dupixent are seeing good results, but what's going on with people who want to withdraw? There is somebody that you guys might be familiar with. Her name is Ashley Ann Laura. She is on Instagram. She's a big influencer for people with eczema. This is on atopicdermatitis.net. This is an article written by Ashley and says why I decided to taper off of Dupixent. So she was one of the people who did the clinical trials for Dupixent. "When I got accepted into the Dupixent trials, I was at my lowest point. I was bedridden from topical steroid withdrawal and was desperate to try anything that could alleviate the unbearable pain and discomfort I was facing. I had lost a large portion of my hair and eyebrows. My skin was shedding profusely, cracked wide open, bleeding, oozing, and intolerably itchy. I was unrecognizable. If you are watching this and you have TSW right now, I know you know how she feels." By this point, Dupixent was showing promising results. I had nothing to lose, and I was excited to from this medication. So her experience with the trial. "During the trials, I was 100% sure I was receiving the actual drug despite it being a blind study," which is basically when a participant is unaware if they're receiving the medication or placebo. So her results. "As soon as I would receive the injection, my skin would tighten up, heal, and the itchiness would significantly reduce. So by the time I entered the 3rd phase of the trial in 2016, I was 95% healed." Ashley says, "I will preach it any day, anywhere, to anyone. Dupixent is my miracle drug. I've gained a level of freedom that's unexplainable. I no longer wake up and look at my skin and then decide what I can do for the day. I no longer have to worry about how my skin's gonna react if I go swimming or if I'm in the sun for too long. I no longer have to worry, period. So why would I ever risk this new and amazing lifestyle? Despite all the freedom this miracle drug has graciously granted me, I purposely and consciously choose to begin tapering off of Dupixent in May of 2017. So basically she was curious if the underlying inflammation was still there. "The first time I withdrew from Dupixent, I lasted 20 days, just 1 day short of 3 weeks. At this point, I was supposed to inject myself every week, and due to the withdrawal, I lasted 2 more weeks without the drug." Side effects. "The leading side effect was extreme exhaustion. I was so tired at one point, I sleepwalked to the bathroom during work and didn't even realize it. I also got a cold sore on my lip and had minor rashes on my stomach, back, on the inside of my thighs. These were all 2 common side effects I had experienced during TSW in the beginning trials of Dupixent." It says that she's still withdrawing from Dupixent. This is in 2019. a little over a year later, and I'm currently on my 11th round of withdrawals from Dupixent. The longest I've gone without the drug was 8 weeks, 5 weeks longer than my initial attempt at withdrawing. I still get the cold sores and the rashes, but later on in the withdrawal process, between the 5th and 8th week mark. I'm very fortunate that every time I inject myself, the drug takes about 3 days for it to kick in and the round of withdrawals begin again. If you're somebody who is going through TSW and you're thinking about getting on Dupixent, I would follow Ashley. I will put her Instagram right here for you guys. She is amazing. She's a very positive person. She has the experience, so maybe you can DM her and just see what's going on with her and her experience in this year. I did actually just find a YouTube video by Seranova. I'll link it in the description box. She made a quick 10-minute video about how she stopped Dupixent for 3 months and her experience. So basically she said that some eczema has shown back up on her arms and on her back, and that it's very, very bumpy. And then she also shared that she did research on people who have been able to get off of Dupixent and they've been fine, or people get off and they have to get back on Dupixent. I'm not sure where she's at now. This video was made in 2019. With her being off of it for 3 months, it seems like the eczema returned. It was no longer on her face in the severity that it used to be. Dupixent is relatively new. I don't know if we have that much information on how people react if they try to get off of the drug, and what long-term use side effects on other parts of the body might be like. I did actually get one more piece of information about Dupixent itself from this article. It says Dupixent's active ingredient is an antibody that binds to a protein that causes inflammation. By binding this protein, Dupixent is able to inhibit the inflammatory response that plays a role in the development of atopic dermatitis. I guess if we are going to compare Dupixent to steroids, it's better because Dupixent is more targeted, but I am curious to understand what suppressing those proteins, like what that does to your body long term. But with the side effects that I understand with issues in the eyes and like nose polyps as well, and cold sores, there's definitely something underlying that's going on that I don't quite understand yet. So I want to just be aware that we don't know fully what it's like, what people's personal experiences have been trying to get off this drug, what the side effects are like. So I do just want you guys to be super careful. And I will reiterate, I am not a doctor, I am not a dermatologist. I am somebody who is so passionate about helping people heal their eczema that I made this video. So if you're thinking about Dupixent, you're gonna have to talk to a dermatologist about it, or get information for yourself on the websites. It's just interesting. And I hope that you guys have been able to gain something from this video and that you do your own research. There are plenty of stories out on the internet. This video could be like 3 hours long if I go through everybody's stories with it. So to summarize everything that you may have gained from this video is a lot of people have seen good results from using this drug. It seems as though you do have to stay on the drug to continue seeing good results. We do not have that much information because it's a relatively new drug. You probably should be trying to heal your body naturally along with Dupixent to actually reduce where the inflammation is coming from. That would probably lead to you being able to get off of Dupixent, to wean yourself off of it in the future if you are doing all of that together. It sounds like it really helps people with TSW. It is a drug that specifically targets specific parts of the immune system related to the skin, related to atopic dermatitis, and the most common side effects deal with the eyes and cold sores, and there could be more side effects. So we're just gonna have to wait and see. This is 2022 that this video was filmed, so as we learn more, I'll keep making updated videos. This is actually already an updated video. I had made a previous video about Dupixent. I was a lot more angry about the drug at the time. This being an unbiased video, I just want to give you guys the facts that I could get from hearing people's personal experiences, reading the drug information, and please let me know that you guys liked this video by liking this video and subscribing to my channel. I just wish you guys the best of luck on your individual journeys. Sometimes those journeys take us down using drugs for healing, and sometimes they lead us down completely natural paths, but whatever you guys choose, I wish you guys the best. So I will see you guys in my next video. Bye!
I like crashing waves, but I wanna see them at first light. after a long